The NOTS ICS Adult Speech and Language Therapy Rotation Programme was set up in response to a high number of SLT students and Band 5 SLTs reporting that they would be attracted to rotational posts. A group of service managers from adult SLT services across the ICS joined together to develop rotation programmes, one in the north and one in the south of the county. These run across acute and community services, IDD and forensics, with each rotation cycle being 9 months long. As static Band 5s became vacant in these areas, we recruited jointly into these posts as rotational posts. Most of these SLT rotation posts are now recruited to with the SLTs in their first cycle of rotation. We hope that by offering these varied and exciting rotational posts, we will support recruitment and retention of staff, as well as developing skilled and versatile clinicians across the patient pathway.
This is Isla. It is an online platform used in a number of NHS trusts across England that can receive photos and videos either sent in by parents and carers or captured by staff. We are using Isla in children's speech and language therapy as one of a number of tools to support our children, young people and their families.
By uploading a video, my therapist can see me talking and interacting where I am more comfortable and using any other languages that I may speak. It also means that my parents or carers can show me at my best or my worst.
Videos allow staff to gather more information about children as videos can be watched over again, to support new staff and each other more easily with clinically tricky cases, to reduce the time of appointments as some assessment has already taken place. In some cases, reduces the number of appointments needed as therapists can identify whether strategies are being implemented appropriately or if more support, guidance and coaching is needed. To use the videos themselves as coaching tools to enable parents to understand and support their child's communication needs.
The Isla project recently won the Quality Improvement Award at the Trust's Oscars.
Across some areas in Nottinghamshire healthcare, the use of restrictive interventions, such as restraint, may at times be required to keep service users, staff and others safe. Incident debriefs, where both staff and service users can reflect on the incident, have an important role in reducing restrictive practice by facilitating the opportunity for the service user to understand, process and be supported after the incident, as well as to inform how we can better support and prevent such incidents in the future.
Traditionally, debriefs may have been conducted verbally, but this can be inaccessible to our service users with speech, language and communication needs. A group of speech and language therapists working across areas including the Orion Assessment and Treatment Unit, Lister Ward and Rampton Hospitals came together with the Trust's Positive and Safe Violence Reduction team to create a visual debrief resource using reusable stickers that was underpinned by evidence-based therapeutic techniques such as comic strip conversations.
There is a prescribed way of utilising the resource at the start of the PAG. It has the potential to be used across any population who have differences and/or difficulties in processing and understanding, including inpatient adult mental health and CAMS services, especially where ASD is present or suspected.
The Visual Resource Pack aims to support service users with speech, language and communication needs to engage meaningfully in their debrief process and work collaboratively with staff teams towards reducing restrictive interventions in the future.
"2023 will be the first year that SLT degree apprenticeships are available. We've been able to put forward 2 apprenticeships within our trust in children's SLT services and in High Secure. In both our services, the apprentices are current speech and language therapy assistants. Julie Belshaw, the children's SLT service manager, explained her reasons for wanting to support the apprenticeship. She said, For me, I wanted to have an apprentice as I've long been aware that our amazing support staff have very few opportunities to access external CPD and develop their careers. I'm passionate about training being available for everyone, and the SLT apprenticeship offered this to the support staff in the service. Additionally, Band 5 recruitment has been a real challenge this year, so home growing a member of our own service into an SLT seemed like a great long-term solution. The reasons the SLTAs gave for wanting to pursue the degree apprenticeship included wanting to work as a qualified speech and language therapist, viewing the apprenticeship as opposed to an undergraduate or master's option as more practical with more experiential learning. Obviously, there's a financial benefit to working while studying, and that the fees are funded by the levy. They explained that they were passionate about and enjoyed their current roles and didn't want to stop working whilst they were studying. The degree apprenticeship starts in January 2023 through Birmingham City University, and it runs for 4 years. We hope that we will be able to support a lot of the placement opportunities within the Trust, and that we will be contributing to the development of the future qualified SLT workforce.